Dr. Schwartz received an MPH in Environmental Health from the University of Michigan School of Public Health in 1981 and a PhD in Epidemiology from the University of Michigan School of Public Health in 1986. She currently holds the titles of Deputy Center Director and Associate Center Director for Population Sciences at the Karmanos Cancer Institute and Professor and Associate Chair for the Department of Oncology. Dr. Schwartz has 30 years of experience conducting NCI-funded case control, cohort, and family-based studies of the genetics underlying cancer with over 250 publications. These studies have primarily focused on familial risk of lung cancer and the genetics underlying disparities in lung cancer risk and outcomes. She is the PI of the NCI-funded largest cohort study of African American cancer survivors, the Detroit Rock Study, which you will be hearing more about this morning. Dr. Schwartz?
Thank you. So I want to talk about the COVID-19 experience in a group of African American cancer survivors. And this is based on the study that Carrie mentioned, the Detroit Rock Study. Next slide. So as you all know, that there are cancer health disparities that we don't particularly and completely understand. Despite advances in early detection and treatment, African Americans continue to bear a disproportionate cancer burden, and the disparities in these outcomes are not well understood. And we're conducting the largest study of African American cancer survivors and their caregivers in metropolitan Detroit to better understand the factors driving poor outcomes. Next slide. So the Detroit Research on Cancer Survivors, or Detroit Rock Study, is enrolling 5,500 African American cancer survivors. This is a population-based study and includes the Tri-County metropolitan Detroit area. Individuals diagnosed with breast, prostate, colorectal, endometrial, or lung cancer, or any cancer diagnosed in an individual under age 50 are eligible to participate. We're collecting biospecimens and clinical data as well as survey data and doing annual follow-ups for outcomes such as recurrence, survival, quality of life, and second primary cancers. Next slide. So this population is a very important one to study because the ROC survivors carry one or more characteristics that put them at high risk of COVID-19 infection and poor outcomes once infected, including African American race, poverty, comorbid conditions, a loss of income, and exposures associated with work and essential services. The early shelter-at-home orders in Michigan have altered cancer care. You saw that in Dr. Thompson's presentation, with some cancer providers delaying treatment and follow-up visits. And there's additional stress associated with income reductions and limiting social support. So we ask our ROCS participants to complete a COVID-19 survey to better understand the added effects of the pandemic on their quality of life. And this was not only spurred on the fact that we have a pandemic that we need to understand, but those individuals completing their ROC surveys were saying some of the things that we're reporting are not because of our cancer, but due to COVID-19. And so we knew in the bigger picture, we needed to understand what was happening at this particular time. Next slide. So I want to just give you a little bit of information about the ROC study. We currently have enrolled almost 4,000 African American cancer survivors. They're primarily doing this through a telephone interview or as a written questionnaire. We had started the online survey and found that more people preferred to do this over the phone or as a written questionnaire. You can see the breakdown of cancer site there. It reflects frequencies of these cancer diagnoses, with more breast and prostate cancer cases included than the other cancer sites. You can see that our follow-up has been outstanding, that once people are engaged in this survey, they are continuing to provide information through follow-ups. So when we started this, we were also on lockdown, if you will. And so the easiest way to get this survey moving was to provide or request participation through the email addresses we had for ROCS participants. We did not have email addresses for everyone. I think we had about 2,000 email addresses. Once we were able to get back into the office on a limited basis, we are now also sending out written questionnaires. And I'm going to present again, this is all preliminary data. We have completed surveys on 530 survivors. We're also enrolling caregivers, and I'm not going to talk about those data at all. Excuse me. Next slide. So this is a very busy survey and slide, excuse me, and I'm not going to talk about the specifics of it, but basically this is to show you that the participants in the COVID survey look very much like the participants in the ROC survey as a whole in terms of their age distribution on the top left-hand side, in their numbers of comorbid conditions that they report on the bottom left. And please take note that a large number of our participants have multiple comorbid conditions. Over 75% report at least one additional comorbid condition. They look similar in terms of the cancer site distribution, again, heavily weighted toward breast and prostate cancer cases, and in terms of the sex distribution. Next slide. So in general, the COVID survey participants report being in good health. Only 20% report their health as fair or poor. And remember, this is a set of cancer survivors, but some of them are a couple of years out from diagnosis. Next slide. About 30% of our participants have been tested for COVID-19. 4% tested positive. 4% tried to get tested and could not get a test, and 66% have not tried to be tested for any reason. Next slide. So 90% or more of the participants are taking the appropriate precautions to avoid COVID infection by wearing a face mask, staying at home, practicing social distancing, and washing their hands several times a day. Close to 90% also report avoiding, thank you. Close to 90% also avoid public spaces and crowds. About half have canceled travel plans or stockpiled food and supplies. Next slide. Over 90% have relied on TV to get COVID information, and apparently they're watching the right channels because they're at least practicing the precautions that are important. 40 to 50% are getting information from social media, family and friends, and their healthcare providers. So this is, I think it's positive in that the right information is getting out there regardless of how people are getting it, reflected by the fact that almost all of these individuals are doing the things they need to do to limit exposure. Next slide. While individually the participants are practicing preventive behaviors, more than 50% are very concerned, and another 30% express concern about the coronavirus in their communities. Next slide. Again, while they're practicing preventive behaviors, the pandemic is negatively affecting their well-being. Almost 60% report feeling anxious, and I've sort of added in my head those that report agreeing or strongly agreeing with the statement, I have felt anxious about getting COVID-19. Another 40% have feared how the pandemic will impact their cancer care and recovery. Another approximately 30 to 40% have expressed feelings of sadness or depression, experiencing changes in their sleep, or experienced feelings of social isolation in this time. Next slide. So we measured feelings of anxiety and depression using the PROMIS survey, and we've categorized those scores as noted on the bottom of the slide. And we compared the scores at the time of the COVID survey to those reported at the time of the ROC's baseline survey. And so this survey was taken usually 1 to 2 years after their cancer diagnosis. So you can think about this as the baseline surveys being somewhere around maybe towards the end of their treatment or right after treatment was finished to the COVID time period that we're calling the survey. So how have things changed over that time? And you can see that there have been significant increases in mild anxiety and depression scores between baseline survey at a time that's stressful around their cancer diagnosis to the time now in this pandemic. Next slide. So we looked also at the impact of the pandemic on medical concerns. About 50% say their general medical care has been disrupted or delayed due to the pandemic. 40% say the same about their cancer care being disrupted, but over 70% feel positive about the measures that their providers have taken and that they're getting adequate information about how to prevent and care for people with COVID-19. Next slide. So a little more specifically, about 70% of survivors have had doctor's appointments other than their cancer doctor. Those have had those appointments canceled by their provider. And 50% have seen their doctors through telemedicine appointments. So they may not be going into the clinic, but are still getting some information through telemedicine. The next slide. So we measure quality of life using the FACT survey and compared again measures at baseline to what we got at the time of COVID survey completion. And the FACT-G total is made up of those 4 components of emotional well-being, functional well-being, physical well-being, and social well-being. And while all but one of these categories showed significant changes, statistically, the last column on the right here talks about minimally important differences. So there's been research as to what size or magnitude of change really means something in someone's life. And only the functional well-being decline was considered to be an important difference. And the questions around functional well-being include things like, are you able to work? Are you able to enjoy life? Are you sleeping well? Are you enjoying the things that you do for fun? And clearly the impact of COVID is hitting there, that none of us can do those things we used to do for fun. So it makes sense that that's where we see the biggest impact. Next slide. So I want to stress that these are, again, preliminary conclusions, preliminary data that we've gotten. We're still have this survey in the field, but we do see from these data that African American cancer survivors are following the guidelines for COVID-19 prevention. They're getting their information from television, so the more appropriate and informative guidelines that can be out there, the better. There's increased anxiety and depression among our cancer survivors and a concern about their community. And while there's confidence in their healthcare teams, some survivors have had interruptions in their healthcare and are seeing their doctors through telemedicine visits, and there is some decline in functional well-being. Next slide. So at the end of the survey, we asked if there's anything else the participants want to comment on. And I put some comments on here that I want to read because it's always important to remember behind these numbers are real people, and they're trying to deal with what we're all trying to deal with on top of being a cancer survivor. So here are just a few of the comments. I lost my husband due to COVID-19. This was devastating. I have never felt so hurt and alone in all my life. I had to go on each and every day. Now I'm going to be having brain surgery. My responses as to feeling depressed or helpless during COVID-19 is because I have lost 2 family members to the virus, was not able to visit them in the hospital, upset that they had to die alone, and we as a family still have not been able to come together and grieve. Haven't been for cancer updates, a lot of anxiety during this time due to other people not taking the virus seriously. The survey helped me realize that I'm not doing enough for my mental and physical well-being. I am literally tired of being sick and tired. I made myself a promise to do better immediately. And thank you for taking the time to do this research. Next slide. So what we're doing next is looking at the data on lifestyle changes. We ask questions about whether there have been changes in physical activity, smoking, and alcohol use, and financial impacts of the pandemic. It'll be interesting to compare these outcomes in cancer patients with what Dr. Thompson is getting in the general population. We need to identify those at highest risk of anxiety and depression to try to develop interventions, how we can support individuals going through very tough times. And then we're going to be looking at the impact of these measures on longer term outcomes and survivorship. I have to put this plug in there because that's who I am, but this pandemic isn't over and we need to stay vigilant. I know I'm preaching to the choir, but please wear a mask, social distance, wash your hands, show some kindness, and remember to vote. Thank you.